So this particular sequence is going to help you to open the hips and hopefully help with some of the low back pain you might be having. So the first thing we're going to do is learn how to build a little tower out of some props. That's going to keep us supported while we explore some deep belly breathing. And then we're going to lie on our backs, do some hip openers, and then we'll move on to some other poses. So of course, as with any other exercise, you want to check with your doctor before you do this, whether you should lie on your back or not, which we will be doing for some of this sequence. So please make sure that all that's clear before you start. And for this practice, you'll need a bolster or a couch cushion or a really big firm pillow. You'll need 2 blocks or a big thick books or something like that, and you'll need a strap or either like a tie or a tie from a bathrobe or something long that you can use to make your arms longer. So gather your props and I'll see you on the mat. Okay, so the first thing we're going to do is build a little tower here. This is a great position for you to be in if you're in Shavasana or if you just want to rest and breathe for a little bit, which we're going to do at the beginning of the practice. So what I like to do is take one block on the high height and the other block long ways on the lower height, and then take the bolster and lean it up against this little tower that you're making here. So you may have to play with that a little bit, but feel like you get it in a place where it's kind of stable. And then you're going to sit right in front of the bolster and then just lie back onto the tower that you built. Now, you can rest your hands on your belly, or if you have some blocks or something, you can put under your arms so they're not just falling out to the sides. Or this might feel really good and you want to try that. Okay, so you've built your tower. Now you're going to come and you're going to sit your butt right in front of the bolster and then go ahead and lie back. So you're in a nice reclining position. And I just have my knees bent and the soles of my feet on the mat. I'm just going to take my hands and rest them on my thighs. If this isn't comfortable, what you can do is take your feet together and the knees wide, and then take blocks and place them under the knees to support you. Otherwise, you can just bend your knees. So we're going to breathe here for a few minutes. So just place your hands on your belly, close your eyes, and just start to tune into your breath. Maybe at first just noticing what's happening with the breath. Where do you feel it in your body? Where does it originate? Do you feel like it's getting stuck anywhere? And just observing those things, just noticing without worrying too much about what that means or if it's good or bad. And the next time you draw a breath in through the nose, just invite the breath to arise beneath your hands. So breathe all the way down into the low belly, into that lower abdominal breathing space. And feel the belly rise as you take an inhale breath and fall back down as you take an exhale breath. Notice what other sensations you might be able to feel. Maybe your back pressing into the bolster, your sit bones grounding down into the floor. And just continue this deep abdominal breath for a few more rounds. Really deeply inhaling, filling the belly up, and then drawing the navel lightly towards the spine on the exhale to draw all the air out. Really contract the diaphragm before you reach for another inhale. And then slowly flutter the eyes open. You can just bring the hands down to the mat, and we're going to go ahead and sit up. So just press your hands down and bring yourself to upright. We're going to move the tower, and then we'll come to lie on our backs and do a few things there. Okay, so you're going to lie on the floor, and you want to have your strap handy. So just have that nearby. So I've got my soles of my feet on the floor, my knees bent, and you really want to scoop your tailbone down toward your feet so more of your back comes into contact with the floor. So I'm just going to place my hands on the floor, maybe widen my feet to almost the width of my mat, and just crawl my feet a little bit away from my butt so I'm not too crunched up. And we're just going to start a windshield wiper motion with the legs. So letting the knees drop down to one side, coming back up through center, letting them drop down to the other side. Nice and slow. You can just let the feet roll to the insides and the outsides as it needs to. So we're getting a little blood flow in the low back. We're starting to take the hips through their range of motion. And if you'd like to create a little vinyasa here and sync up the breath with the movement, it's an inhale breath as you come up through center, and then exhale as you go down to one side. Inhale as you come back up, exhale back down to the other side. So keeping with that deep belly breath that we did before. And then go ahead and come to center. So I'm just going to scoot my feet in a little bit. I'm going to pick up my right foot and bring my knee toward my chest, and then go ahead and start to do some hip circles. So when I come close to my body, I'm bending my knee, and then as you go away from your body, you're going to extend the leg. So just let your hips rock from side to side. We really want to take the leg through the full range of motion here. And just do it nice and slow. It's definitely not a race. Go ahead and switch directions. Continuing to breathe. And return that foot back down. And we'll do the other side. Think about scooping the head of your femur into your hip socket, like you're kind of trying to get the last little bit of peanut butter out of that jar, scooping around. Get the synovial fluid moving and the joints, warm up the joints. So a lot of times if we have back pain, it's because our hips are super tight. And for those of us who are carrying children, our center of gravity is a little bit off, so our body doesn't quite know what to do with itself. All right, so once you finish that side, you're going to return both feet down to the mat. And then we'll go ahead and take the strap. You want to loop the strap around the ball of the foot and take the leg straight up into the air. So we want the leg long and the arms long. So if you're trying to be really close by to your face and your knee is bent and you're straining up off the floor, that's not what we want. So take your leg as far away from your face as you need to be able to have the leg comfortably straight. So for some of us, our hamstrings are talking to us right now, and that's okay. Just breathe into the hamstring. It's kind of just a little imagination experiment. Inhale deep into the belly, and then as you exhale, see if you can imagine sending the breath to wherever you're feeling the sensation, wherever you're feeling a stretch. And just hold here and breathe for a few minutes. If you like, you can take that other leg and lengthen it along the floor and really press out through the heel so the foot doesn't go lazy and just fall off to the side. Really press through the heel. If you do that and it hurts your low back, just keep the knee bent. All right, so we'll take both sides of the strap in the left hand. Take your right thumb and put it into your right hip crease so you can sort of roll that hip away from you. And then just come across your body about 3 or 4 inches, and you're going to feel some sensation in the outside of this right leg. If you come over like this and your hip rolls up off the ground, you went too far. And just breathe here. All right, we're going to come back up to center. You can either bring your foot back down to the floor, or you can just catch the strap with the other foot, and we're going to do it on the other side. So, leg is long, arms are long. This side might feel completely different than the other. Think about flexing your toes toward your face. Notice if the kneecap is kind of to the center, to the midline of the body, or if your leg has splayed out to one side or maybe to the inside even. And then you're going to take both sides of the strap in the right hand. Take your left thumb, put it in your hip crease, roll that hip away from you, and then just come across the body just a few inches until you feel that sensation in the outside of the left leg. All right, come back to center. We're going to let go of the strap, bring that foot back down. This time, you're going to bring your right knee into your chest and then take the knee wide, like out towards your armpit or towards your shoulder. And then you're just going to bring the lower leg up toward the ceiling. And I'm going to show you with a strap. Just put the strap around the foot and then think about pulling that knee down toward the floor, toward your armpit. Now, you want to make sure that this hip stays down. We don't want to roll over to one side. So maybe even take your hand and press that hip down. You can let this knee kind of fall out to the side. But the main thing we want to work on is bringing that knee down toward the floor. And I've got my foot flexed. It's like I'm doing kind of half a sumo squat on the ceiling. And this is actually happy baby pose. We're just doing it on one side. So if you know happy baby and you want to do both legs at the same time, that's totally fine. But sometimes one side is a little bit easier on us if our hips are really tight or our back is really painful. All right, so we're going to remove the strap. We'll do that on the other side. Bring your left knee up and out toward your armpit. Lasso your foot. And go ahead and find that on the other side. So really bring the knee down toward the shoulder, toward the floor. Keep this hip down with your hand. And breathe. All right, so now we're going to release that strap and return that foot to the mat. And we're going to come to our hands and knees. So gently just roll to one side, and then you can press yourself up, and we'll come to hands and knees. If your knees are sensitive,